Today's presentation is presented to you by Teacher Yani. Our focus for today is seizure disorders and epilepsy. In order to understand more about it, let's first look into its definition. A seizure is a sudden uncontrolled burst of electrical activity in the brain. It can cause changes in behavior, movements such as alternating, stiffening, and jerking of the arms and legs, sensations, or a loss of consciousness or altered consciousness level. The most common part of brain affected includes frontal cortex, hippocampus, amygdala, temporal cortex, and also olfactory cortex. The types of seizure can be classified into three types, which is the first one is focal onset, generalized onset, and also unknown onset. The term focal is used instead of partial to be more accurate when talking about where seizures begin. Focal seizures can start in one area or group of cells in one side of the brain. There are two types of focal onset seizures include aware seizures and also impaired awareness. Aware seizures happens when a person is awake and aware during a seizure. It is called a focal aware seizure. This used to be called a simple partial seizure. Next is impaired awareness. When a person is confused or their awareness is affected in some way during a focal seizure, it is called a focal impaired awareness seizure. This used to be called a complex partial seizure. The motor symptoms of focal onset seizure may also include jerking, muscles becoming limp, tense, brief muscle twitching, or epileptic spasms. There may also be automatisms or repeated automatic movements like clapping or rubbing of hands, lip smacking, or chewing or running. The non-motor symptoms include the examples of symptoms that don't affect movement could be changes in sensation, emotions, thinking, or cognition, autonomic functions such as gastrointestinal sensations, wave of heat or cold, goosebumps, heart racing, or lack of movement. The generalized onset seizure usually happens when both sides of the brain or groups of cells on both sides of the brains happens at the same time. The motor symptoms may include sustained rhythmical jerky movements, muscle becoming weak or limp, muscles becoming tense or rigid, brief muscle twitching, or epileptic spasms. The non-motor symptoms are usually called absent seizures. This can be typical or atypical absent seizures. Absent seizures can also have brief twitches that can affect a specific part of the body or just the eyelids. In order to recognize an unknown onset seizure, usually when the beginning of the seizure is not known, so thus it is called unknown onset seizure. A seizure could also be called an unknown onset if it is not witnessed or seen by anyone. For example, when seizures happen at night or in a person who lives alone. As more information is learned, an unknown onset seizure may later be diagnosed as focal or generalized seizure. As for the unknown onset seizures, motor seizures are described as either tonic-clonic or epileptic spasms. Thus, the non-motor seizures usually include a behavior arrest. This means that the movement stops, the person may just stare and not make any other movements. In relation to seizure disorders, epilepsy is also called a seizure disorder. It is a chronic brain disorder characterized by recurrent seizures that happens more than twice in less than 24 hours. Thus, a single seizure in less than 24 hours is not considered epilepsy. Causes of epilepsy are different for each person, and some people have no identifiable cause. Some of the most common causes include infections. Infection is probably the most common cause of epilepsy worldwide. If there is a proof of a brain infection that leads to seizures, this is considered an infectious cause of epilepsy. Next, autoimmune epilepsy. When your immune system protects your body from foreign substances and other things that could hurt it. Autoimmune epilepsy is caused by a change in your body's immune function. Next, genetic causes. Some types of epilepsy run in families, passed down from one generation to the next. Other types of epilepsy may be from genetic changes that you inherited and are happening from for the first time. Next, metabolic causes. Your body contains enzymes that are responsible for processing the food you eat. If there is a problem in one of these enzymes, this can lead to issues breaking down food or making the energy your body needs to function. And lastly, structural causes. There are certain abnormal structures in the brain that can increase the risk of seizures. This might be something you are born with or develop later in life. Most structural causes can be seen or imaging of the brain with an MRI. Listed is the list of causes of epilepsy by age of newborns. If infants or children have seizures or epilepsy, it may be caused by fevers, infections, or brain tumor. The causes of epilepsy from children to adults may include something that you are born with, degenerative factors, have history of head trauma, and also progressive brain disease. The most common causes in older adults include stroke, Alzheimer's disease, and also history of head trauma. Although there is no known cure for epilepsy, developments in treatment may have made it possible for most people to achieve seizure control. The first treatment step is usually to find the right medicine or anti-epileptic drug AED. If seizures continue to happen, other treatments like devices, dietary therapies, or surgery can help control seizures. That is all from me. Thank you.